Hi, this is Mark Toyce of the evaluation team. I'm the team lead, and I'm just going to be doing a very quick introduction to the A360 independent evaluation that will take a couple of minutes, and then I'll be handing over to each of the component leads that will talk in much more detail about their components. Each of the component leads are going to be talking for around 10 minutes, and then after those combined presentations, we look forward to Q&A and a discussion around the evaluation approach. So I'll just quickly kick off with my first slide and just look at what's the key primary outcome of the evaluation across all of the components. And just reading from the slide, it's increased voluntary modern contraceptive prevalence rates among adolescent girls aged 15 to 19 in the project intervention areas, which is, of course, Nigeria, Tanzania, and Ethiopia. And then just to take you through briefly the evaluation kind of component architecture. There's three key technical components of the evaluation. The first is an outcome evaluation that's looking at measuring change in terms of outcome indicators across time and trying to attribute change in those outcome indicators to the A360 project interventions. There's a process evaluation which is trying to look at what actually happened in practice during the course of the A360 intervention over time, and that's a mixed methods approach to evaluation, both combining primary data and secondary data and a combination of methods. And then finally, a cost effectiveness analysis that's looking at the cost of different elements of A360 and then looking at how much, what the relationship is between cost and the outcome variables for A360 with the aspiration of comparing the cost effectiveness of A360 in comparison to other hopefully similar program intervention activities and programs. So with that, I'm just going to hand over to the first component lead who's going to present in more detail, which is Gabrielle, and she's going to present the process evaluation design.
Thank you very much, Mark. Yes, Emma, next slide. So I'm the process evaluation lead. We'll introduce the team in some slides that are coming up. But just to start with the process evaluation objectives, we are looking at essentially 5 key objectives. I will read these out. I think they're important. To provide analysis and learning to support adaptive management and course correction. So we would really be looking at that through the pilot and scale-up phases. To evaluate how the approach has played out in implementation. To investigate how A360 is interfaced with the different contexts that you will be working in. To evaluate the experience of A360 amongst adolescents and community members, and how it affects perceptions and opinions about adolescent use of contraception. And finally, to investigate how solutions have been operationalized and their feasibility for scale-up and replication. Next slide. So essentially, the evaluation framework covers 4 domains, which are process, experience, context, and solutions, which very much align with the objectives. We have, next slide, key questions that we are looking to answer through this. Process is looking at how has A360 approach been operationalized in practice. How has A360 program interfaced with the different contexts in which it has been implemented? That's context. Experience, what has been the experience of A360 amongst adolescents and community members? And how does it affect perceptions and opinions about contraception? Finally, solutions. How have models been operationalized and what have been the effects on adolescents and community members? So we would be looking at that in particular through the various phases of their development. The next slide presents some of the sub-questions that we are looking to answer in relation to these 4 domains and the major questions. I won't read these out, but suffice to say that this is really the meat of what we'll be looking at. And as this presentation will be available to you, you can explore it in more detail. Moving on. Yes, there's a lot of questions. Overview of the process evaluation design. We will explore these domains in the next slides, but essentially it is looking at a combination of primary data collection and secondary data collection. And we've got various data analysis methods that we will be using, which I will also explain. Next slide. In terms of primary data collection, we've got 5 main areas that we're looking at. They are in-depth interviews. So we will be exploring this with yourselves, A360 Consortium. Also ASRH partners. At the moment, those are defined as government, both at national and subnational level. As well as key reproductive or family planning partners. That would include Mary Stopes, it would include IPPF, it would include UNFPA as examples, but we would also be delving into some of your local partners as well. In addition to that, we would be looking at service providers, the ones that you're specifically working with through with A360, and community experts. I think we have actually decided not to look at clients in this area. Peer research with adolescents. We are proposing to use a methodology that Options Consulting Limited has perfected, and essentially having adolescents or youth interview adolescents. Focus group discussions, we are planning to do that with adolescents, both boys and girls, and community influencers. Direct observation will also be, and it actually has already occurred. We are doing direct observation of the boot camp, for example, that happened in Ethiopia, but I've also done some observation in Tanzania. And we're looking forward to it in Nigeria. So this will be a continual action. Finally, looking at the possibility of introducing after-action reviews that would be an adjunct to the observation activities, which would really be to gather some of the people involved in those activities and discuss with them their thoughts and observations in terms of how that went. Next slide. Use of secondary data. So we've got a number of data that we're looking forward to reviewing and have actually already started to look at. So in order of the phases, inception documentation, we've had the pleasure of looking at all of that. A360 formative research, some of the user-centered design process data, and looking at how we can best capture that, and so we're considering the sticky notes, of course, the notebooks that you use, the session observations, and prototypes, the design briefs that you're developing, for example. Your monitoring data and learning system, so working very closely with you on what that will look like, and starting to engage in that sphere. Other project sources of evidence, of course, with Trigger Eyes, the Movocado system, some of the operational research that you will be doing, and any other documents from other partners. Secondary, in terms of non-project documents, of course, we're very interested in any outcome data that would be available through governments. For example, Tanzania has recently released a preliminary DHS, so we'll be looking at that. There's a lot in the academic literature that we'll also be exploring, and I think there's been quite a lot that's been emerging in the last 6 months or so in relation to that. Next slide. We are also hoping to use sounding workshops as both an opportunity to explore with you, but use it as an opportunity for analysis as well. So these are participatory workshops that will be facilitated by ourselves, and we're hoping that we'll have your participation, but we're also looking forward to having other stakeholders, particularly government, participate in those. We are proposing to do our first one in Tanzania in early 2017, so we will pilot that. It is a platform for joint analysis in order to generate findings and insights for the project. We're really hoping that these will be jointly analyzed and understood by the different country platforms. We are looking at emphasizing collaborative reflection, interpretation, learning, and course correction. So this is really where that objective comes in, aiming to feed into key decision moments for A360. So those will very much be aligned with the phases of A360. So these will, what we're looking at is doing these at country level. We won't be doing any kind of regional sounding workshop unless you decide it's useful. But we're really looking at exploring country level because we feel that we'll get the level of granularity that's required for that. Next slide. The products that you can anticipate, and the first one is actually due in December at your regional insight workshop. They will be country insight decks that we will produce, thematic insight decks, looking at one per cycle, similar to the country ones. And then in addition to that, our midterm and final reports, which will be presented to our donors. And then, yes, finally, the process evaluation will feed into annual reports. Next slide. This is the team. Mark has introduced himself, and I'm the person speaking to you is Gabrielle. I'm sure you're aware of that. I'm working very closely with two people based in Brighton, the Emmas, so both Emma Mulhern and Emma Nubat. Emma Nubat is actually the deputy for the overall evaluation. And then at country level, we're very pleased to say that we've been able to engage with very capable national consultants, Catherine Morenike and Sarah Witt, representing respectively Tanzania, Nigeria, and Ethiopia. They have in turn identified junior consultants that will be working with them. So you will start to see that their faces should become familiar, and it will be a combination of themselves and also a junior consultant. In both cases, we are, at least the ones that we've presented so far, we are still looking in Ethiopia. They are younger people, so we were hoping to keep this in the spirit of A360. Next slide. And you'll have the pleasure of knowing that I am not going to go through the details of this slide, but suffice to say that roles and responsibilities have been carved out between the evaluation team and PSI, particularly in relation to the process evaluation, which is what I'm speaking to, and that we are actually in the process of engaging with the country programs and sort of really digging into this particular piece of work. Next slide. Thank you very much.
Hi, this is Mark speaking again. It's just very briefly to hand over to to Aoife, who will present the outcome evaluation presentation now. Thank you, Aoife.
Aoife, are you still on mute?
It looks like I'm not able to unmute. Okay, she's.
Hello?
Yep, we
Hello?
can hear you.
Okay, is it my turn?
Yes.
Okay, sorry, my internet just went down there for a minute. Okay, thanks everyone. So my name is Aoife Doyle. I'm going to present the outcome evaluation, which LSHTM in the UK are leading. Next slide, please. So the two main evaluation questions that we have are firstly, how has A360 affected the prevalence of modern contraceptive use? So this is our primary outcome, MCPR, and other key reproductive health outcomes among adolescent girls in the A360 countries. And secondly, how has A360 affected key intermediate outcomes? And these are ones that we've taken from the A360 theory of change that was developed by the implementing partners. Next slide. So the primary objective is to determine the impact of A360 on the use of modern contraceptives by 15 to 19-year-old girls who are living in the A360 target areas in Ethiopia, Nigeria, and Tanzania. Next slide, please. So the secondary objectives are to determine the impact of A360 in the same population on a number of reproductive health outcomes and also the intermediate outcomes that were defined in the theory of change. So there are other reproductive health outcomes that we're interested in measuring: age-specific fertility rates, age at first birth, unmet need for contraceptives, and then the intermediate outcomes as defined in the theory of change are knowledge, agency, and attitudes. So the value of the use of modern contraceptives to prevent unintended pregnancies. Adolescents, girls, access to contraceptive services and products, and also to try to measure community acceptance and social support for the adolescent girls to adopt healthy sexual reproductive health behaviours, which would include the use of modern contraceptives. So I should stress that this list is probably still up for discussion as we haven't finalised our protocols, but these are the main outcomes that we're thinking of as secondary outcomes. So we're a little bit, we're not quite so far on as the process evaluation. We're at the stage of really designing the outcome evaluation, and there's sort of three steps that I see. The first is gathering information, and that's the phase we're at now. And this will involve just really trying to understand very clearly the A360 implementation plans. So which populations will be targeted, when will A360 be rolled out, and then what's also important in terms of designing the outcome evaluation is the reasons why the target geographies have been selected. So I've been trying to, through discussions with the various partners, trying to find this out. We're also interested in understanding at which level A360 will be implemented. And in this project, this is a particular challenging question because we're not clear about what the interventions are, but it has been possible to find out roughly at which level the interventions will be implemented. And I'll come along to that later in more detail. And linked to this, the number of potential clusters or areas that will receive intervention, whether randomization of A360 to certain areas or populations is going to be possible, and is there a suitable counterfactual? And I'll go into these in a moment. Once all that information has been gathered, what we will then do is define and discuss potential study designs for each country. So it's likely that each country will have a slightly different situation, so study designs will be slightly different. The outcome evaluation team have a fixed budget for the outcome evaluation, and the discussions to date have focused on a plan to more likely focus resources on one country where we will do a more in-depth, larger evaluation surveys, and the other two countries most likely will have smaller surveys. But this, as you will see in step 3, our aim is to find a feasible and affordable package of outcome evaluation studies that will cover all 3 countries. So none of this has been decided yet, but I just want to emphasize that any information that I present, it will depend on balancing the resources across the 3 countries. Next slide, please. So for those of you who are not familiar with this term, this is counterfactual is what we imagine would happen in the absence of the intervention. And if we want to compare populations exposed and not exposed to A360, we can do it in 2 ways. We can do it in terms of place, so we can compare areas that received A360 and areas that did not, or we can compare time periods. So we could compare a population, the outcomes in a population of girls when they were exposed to A360, and then compare it to a time period when they were not exposed to A360. So linked to this, a key concept in outcome evaluations is randomization. So this is where interventions are randomly allocated. So they're allocated by chance and not purposely allocated to populations or areas or time periods. If we're comparing geographies, we need to get the most comparable non-A360 areas as possible. And randomization is the best way to do this. So this is why randomized control trials are often used to evaluate interventions and are considered a very rigorous, high-quality evaluation design. If we're comparing time periods, then the more time periods we have, the better, as this will allow us to assess whether there's been any temporal change in the outcomes, so whether things have changed over time, regardless of the intervention. Next slide, please. So what I'm going to present is 3 slides showing for each country what we have, the information that we have gathered to date. So in Ethiopia, 5 out of 9 of the regional states and 2 chartered cities are going to be targeted. All adolescent girls will be targeted, and as in not only unmarried or married or other segments, so the aim is to target all girls. And the level of implementation, to our current knowledge, will be district level, so interventions will be rolled out at the district level. We're not aware of any plans for phasing the rollout, so all areas will receive the intervention at roughly the same time. Randomization does not appear currently in the plans, and that target districts have already been chosen based on certain criteria. So the criteria that we're aware of are population density and child marriage rates, so areas that are at higher need of A360. And just to give you an example, in southern Tigray, 3 out of 8 districts have been selected. And in central Tigray, some of the districts have also been selected, but in some of the zones, all districts have been selected. So there's quite a lot of variation there. So in terms of our study design and analysis, the cluster would be the district. And so potential comparison areas would be non-A360 districts, either within those target zones or in neighboring zones. And I'm planning to make a visit to Ethiopia early next month, and so I'll refine this information based on discussions there. Next slide, please. So I've just come back from Nigeria, so this information I've recently discussed with the team there. They're targeting 10 out of 36 states, divided between North and South Nigeria. Again, all adolescent girls targeted. They plan to implement at the level of local government area, and in 3 phases. So 3 states will receive the intervention next summer, following 3 months later by 3 further states, and 3 months later by the final 4 states. Randomization was not originally in their plans, though we did recently discuss some potential ways that randomization could be incorporated into their implementation plans, and these are still under discussion. But what they're currently thinking is that within each state, 60% of the LGA within that state will receive A360. And in a similar way to Ethiopia, there's been criteria that have been chosen. So based on population density, so the number of adolescent girls, whether there's already a level of contraceptive use in that population, if there's service providers that that will be able to implement any interventions, and how accessible the populations are. So in a similar way, LGA would be our potential cluster, and so comparison areas that we could consider would be non-A360 LGA, either in the target states or in non-A360 states. Next slide, please. In Tanzania, 10 out of 25 regions have been selected. Again, all adolescent girls, we understand, are to be targeted. And the level of implementation will be the region. So regions are clustered into zones, and A360 will be rolled out zone by zone. So there will be some element of phasing, but we haven't discussed the details with Tanzania yet. There's no plans for randomization, as almost all districts within their target regions will receive A360. The exception being areas that will receive DREAMS, which is another HIV prevention intervention for young girls. So in Tanzania, we understand the cluster would be the region, and so potential comparison areas would be non-A360 regions. So these details may be when I understand things a little bit better after my visits to Tanzania and Ethiopia next month. Next slide, please. So based on this information that we have to date, the strongest study design that we think might be possible would be a control before-after study. So this would be similar to a randomized control trial, but there will be no random allocation of intervention. An alternative, less rigorous, but cheaper and smaller study would be a cross-sectional study just in the intervention communities, so a pre-post study. So most of these designs would involve a cross-sectional survey at baseline and a cross-sectional survey at endline. We do also have an option of doing a cohort study where we recruit girls at baseline and follow them up till endline. And that is an option that we will consider. Next slide, please. So this is our work plan. As I mentioned, I'm making a number of site visits this month and next month, and we're going to have an internal evaluation expert workshop here at LSHTM. And then we plan, all going well, to, following discussion of our proposed study design with all the partners and funders, implementing partners, evaluation, and the funders, we will submit our protocols to research and ethics committees towards the end of this year, with a plan to start baseline surveys next summer, all dependent, of course, on ethical approval. The baseline report will then be available about 6 months after the survey data collection was completed. And endline surveys are currently planned for autumn 2019. So this will be 2 years after the baseline survey, with the report 6 months after that. I think that's the last slide. Yeah, thank you.
Hi, this is Mark again, and I'm just going to hand over now to Michelle, who's going to present the cost effectiveness study components of the independent evaluation. So over to you, Michelle.
Great. If you could go to the next slide. So the cost effectiveness study is really complementing, I would say, both the process evaluation and the outcome evaluation, because there's sort of two pieces to it. So the first is more linked to the process evaluation, but understanding not only what happened, but the cost of what happened. So getting a more in-depth understanding of what it costs to deliver the A360 program in different contexts and what different cost drivers were. And then the larger picture question, which links more closely with the outcome evaluation, is to understand the cost effectiveness of A360. And Aoife talked a bit about the comparator, so this is going to be building on that same idea and understanding the relative cost of implementing A360 to achieve the outcome that's achieved versus something else. Next slide. So that is helpful just to lay these two pieces out relative to the timeline. So there's actually going to be two different deliverables or two different studies. So first is the costing piece, which is going to go through the pilot phase and is really going to be focused on taking all of the money that's spent under A360 and allocating it out to the phases and key milestones within each phase, and also then looking at it across input types. This will also be done by country as well. And then the cost effectiveness study is going to go through the end of the project, so picking up on the scale part and really looking at the cost of achieving the impact that happens under scale. And this is going to take a bit of a wider perspective, so not just looking at what's in the A360 budget, but also looking at other costs associated with achieving the impacts of A360. So this could be things like the costs for adolescents to access services, especially if it's models where they're paying for those services, potentially the costs of providers to serve the adolescents, and again, depending on the models and sort of where services are being delivered under A360, and then other costs that'll be a bit dependent on the final design. Next slide. So in terms of data collection and analysis, so on a quarterly basis, we're gonna be receiving financial data from PSI as well as the partners, so that's SFH Nigeria as well as the other sub-partners. And a big thanks to Alexis and team who have been great about getting this data together and to us and answering questions on it. And so we're going to be going through a quarterly process where we look through that data and basically try to allocate all of the spend to a phase and then to milestones within the phase. And so just to clarify, because I know in the past there are some questions about this, that really the heavy lifting is going to be on our team. So that occasionally, and you'll see this in the next part, we might need some additional information from you all. So we're getting some information from the process evaluation, which helps us understand what we're seeing in the cost data, but we might need some additional information. So an example is we can see a lot of travel within the budget and figure out sort of who took how many trips, but might need some additional information about what country those trips were to or what they were for, so we can make sure that those are correctly allocated. So we're still working out a process on this, so we might do it through some surveys or meetings. We're gonna figure out whatever makes it easiest for you all to get us that information that we need. Next. So once we get into the second part, the cost effectiveness study, there's also going to be a need for us to collect some data beyond the A360 budget. And so this is still being worked out as the designs are coming together and as we get a better sense of what scale up is going to look like. But again, this will be on the cost effectiveness team to pull together, and it'll be done through a mix of primary data collection, but then also literature reviews, so using published cost information of potential comparator programs. Next. So this is just a little summary table of some of the things that we are thinking about in the cost. So I'd say the one that's probably most relevant for you guys are one is, I guess, thinking of costs related to specific elements of the design. So for instance, if a design is used that uses vouchers, there might be a need to look at how we're capturing those costs. Another piece we've talked about with PSI Tanzania is that there is a fair amount of UCD work done on a previous grant. So that's kind of put them at a different stage within the process. And so being able to account for the money that went into those previous projects, because those are part of the whole cost of the Tanzania program, being able to implement an A360 is really building on that. So as you see, there's sort of various costs that we're going to have to look to gather beyond just what is in the budget of A360. So in terms of products, so after the pilot stage ends, there's going to be an initial costing report. So this is what's looking at sort of what was spent up to piloting and how we can understand how that relates to the different phases and milestones within the project, and hopefully start to get some understanding of various cost drivers, both to help think about the scaling, but also to help think about replication of a A360 type approach in other settings. There'll be an end-line report, which is where the cost effectiveness studies will come together. And then we just through our kind of what is owed to our donors, there'll be some other reports along the way which summarize findings. And we hope to look to doing a joint publication with the outcome evaluation results and the cost effectiveness results that can really pull together all of our understanding of the effectiveness of A360. Next. And that was it from me.
So it's Mark again. This is just now to open the floor up to questions and comments and thoughts from you all, please. Yeah, so we're all assuming that was all completely crystal clear and very simple. And if anybody's got any questions or any concerns, that'd be really great to hear your thoughts. Hi, Alexis. It seems that everybody is fully satisfied with all of those presentations, and there don't seem to be too many questions. Should we conclude?
That sounds great.
Hey, Mark,
Yeah.
Melissa Higby. I just want to ask a quick question.
Sure, Melissa.
Thanks for the presentations. I found those to be really helpful and clear, so I actually don't have that many questions. I noticed in the cost effectiveness evaluation presentation, you talked about those UCD costs that were incurred before the project started, and that's specific to Tanzania. I was just wondering how you guys were thinking about handling that same issue for the process and impact evaluations. Will there be any special consideration for the work that happened before the A360 project kicked off?
So I'll try. That's a really good question, Melissa. Thank you for that. That provoked me to think about things in a different way. I think I'll try and answer that question, and then I've got other Itad colleagues here who will also be able to respond, and then the relevant component leads can also respond. I think for the outcome evaluation component, I don't think that we can incorporate the perspective of work that's been done previously, because the design that we're probably looking towards is a kind of a baseline, in the future, and then later, towards the end of the project. So I think inherently we wouldn't be able to incorporate what Tanzania has already done into the outcome design. And I'll ask Aoife in a minute whether she agrees with me or not. From a process evaluation perspective, I'm here with both of the Emmas, and Gabrielle's here. So I think I'll hand over to them to provide their insights there. So maybe first of all, we'll take the process evaluation, and then we'll move on to the outcome evaluation. So I'll just hand over to the Emmas, and then if Gabrielle's got anything to add, she can do.
Yes, I think from my perspective, and I hope other colleagues will pile in should they disagree, but sorry?
Say which Emma.
Oh, sorry, this is Emma Newbat. I'm also here with Emma Maher. From our perspective, yes, we really want to make sure that we capture the unique Tanzania experience, and that will obviously mean reflecting on what's happened before, let's say, the official start of A360. As part of the process evaluation, we'll be looking at how A360 has played out as a whole, but also how it's played out in the different settings, how it's interacted with the different settings, why that's been. So yes, we definitely want to capture the uniqueness of Tanzania.
Yeah, and maybe just Emma Mulhern, adding on to what Emma Nevat has said. We've already conducted a visit to Tanzania, as many of you probably know, and have done a first round of key informant interviews, which we haven't done in any other country yet, and are reviewing the documentation that existed pre-A360, as well as has been created in the last few months. And the team in Tanzania have been really great and open about speaking about pre-A360 and the transition process. Gabrielle may wish to add.
Nothing else to add. I think the Emmas have captured it very adequately. It's inherently part of our exploration of A360 in Tanzania.
Hi, this is Mark again. So I'm going to hand over to Aoife to add her perspective from the outcome evaluation.
Thanks, Mark and Melissa. I think from the outcome evaluations point of view, what we will be interested in learning from you is where any sort of pre-A360 interventions have been implemented, and what they entailed, and for how long, and who the target populations were. And if we felt that they were quite substantial, we may decide, for example, to choose areas for the outcome evaluation, different areas, not those areas, or different populations. But I don't know enough yet about what's gone on already, and I'm looking forward to finding out more when I visit next month. But it's certainly something that we will think about. But whether it'll affect the eventual evaluation design, I don't know yet.
Does that answer your question, Melissa?
Yes, thank you guys. That helps a lot. I would say that you'll have more conversations with the Tanzania team when you visit, but I wouldn't say that there have been substantial interventions that have happened thus far. I was actually thinking about what is going to happen between now and your baseline survey in May through September 2017. And we may need to just think carefully about what makes sense so that we're able to capture data, but also then able to move forward with the ideas. So it's just something to continue talking about.
Yeah, great. Thanks, Melissa.
Does anybody else have any questions or any thoughts?
Well, maybe Alexis, just as a way of wrapping up, when we have been visiting the country teams, we have been opening with a brief introduction to the evaluation. So hopefully they'll be able to review and watch this webinar and digest it. We can maybe answer some of their questions in person, and we're also available to take their questions over email. But over the next few months, they should be seeing some of us in person anyway.
Okay, great.
And just to say, Mark speaking again, just to say from my perspective, all of the people from the evaluation team that have been going out to do trips in their various guises have been very pleased with the kind of warm welcome that they've received, and they've been really, really pleased with the level of engagement and the detail of information that's been provided, the level of kind of energy that's been kind of associated with those trips. So I just wanted to say thank you to PSI and all of and all of the country programs for their help. It really makes a big difference to us.
That's great to hear, and I'll be sure to pass along the message.
Thank you.
And thank you for the presentation. It was very useful for all of us.
Great. Thanks.
Great. Thanks for inviting us. And yeah, take care.
Thank you.
Thanks.
Thank you.
Thanks. Bye-bye.
Bye-bye.